And in too many cases, people throwing up their arms and deciding not to listen to medical and public health voices. And certainly there's blame to fall on the side of the experts here as well. Far too many people, and I'm sure myself included at some point, stated some assumption about COVID that later proved not to be accurate. And to be sure, we'll continue to learn more about the virus over the coming months and probably even the coming years. There's much that we still don't understand, and we need to recognize that and be honest about the unknowns. For example, we don't know how much immunity is provided after you get sick. There's been demonstrations of reinfection, which puts a big question mark on the idea of durable immunity or lasting immunity to not be reinfected after you have the virus. We also don't understand why some people appear to be what are often called super spreaders. That is, they transmit large amounts of the virus during illness, while others who seem just as sick apparently do not. Furthermore, this being a new virus, we don't have a good idea of long-term effects. We know that certain viruses can cause prolonged or delayed complications well after the more immediate effects wear off. We have seen this with COVID-19 and multi-system inflammatory syndrome in children, which can occur well after the initial infection has resolved. In the same vein, we're still learning about the effects of this virus that go beyond the respiratory system. We've seen many cases of the virus seemingly negatively affecting the heart, the kidneys, as well as causing blood clots and strokes. This is all to say that COVID has been a challenging moving target for understanding, both from the perspective of the experts as well as from the public. This is why we hope that this new website, Test Up MKE, will be so valuable. It should serve as a single source of truth on questions regarding testing. Who should get tested? How do you know, how do you go about getting tested? And what does your test result mean? We're seeing areas of the county with increased concentrations of cases, and we expect to see increased case numbers going into the fall. So having this information easily available and readily accessible will be more important than ever. So shortly we'll learn more about the Test Up MKE website, which importantly will not replace 211, but will be a great addition and in multiple languages for folks who want to learn more about types of COVID tests, the testing process, and many other areas. Thank you very much and stay safe.
Thanks, Dr. Weston. Now we'll go over to Darren Rausch at the Greenfield Health Department.
Good afternoon, everyone. It's my pleasure to join today. I'm going to go ahead and share the data because there's a couple highlights that are important to note for this week. So we're going to start today with the kids data. This particular report we've created and shared for a number of weeks. This is looking at daily cases of COVID-19 amongst Milwaukee County children under the age of 18. And you will see when I show you the whole county report, the trends are very similar. We've talked about that in the past. More recently, we've noticed a pretty consistent number of cases over the last several weeks, actually. A little bit of a plateau, but probably even a little bit more of a decrease in the suburban communities as indicated by the blue line than the city of Milwaukee. By comparison, when we look at the same report amongst the entire county population that I have now put up on the screen, we start to see a little bit of an increase as we look at our daily cases here, as well as an increased 7-day average in the city of Milwaukee and a plateau in the county. This is something we're going to want to watch very carefully in the coming weeks because it may be indicative of a slight upswing in cases throughout the county. We've shared death data before. Largely, our death data has been very consistent. The rates have been consistent for several months. We're still bouncing around that 1 to 2 deaths average in both the county and the suburban communities. Our hospitalization numbers remain pretty consistent as well. We've talked about the reproductive number a lot, and as we saw the spike for the city of Milwaukee, we would expect to see a blip in our transmission rate. Remember, the transmission rate is a number that indicates how many cases are coming from one laboratory confirmed case. And a transmission rate of 1 would indicate that for each case of COVID-19, on average, 1 additional person would become symptomatic. What we are seeing here in our rates is that we had a couple days ago our 7-day transmission rate was well above 1, almost at the 1.25 level. And when we drill down on this number a little bit more and we compare both the city of Milwaukee and the suburban communities, we see that the increase is largely in the city of Milwaukee, with that rate almost reaching 1.5, while the transmission rate in the suburban communities is around 1. So it indicates to me that there's an increased activity in cases, as we saw in the previous data, within the city of Milwaukee that will bear more attention in the coming days and week. We've been tracking for a number of weeks different demographic indicators and demographic variables, and I want to continue to point out that our fastest growing population and cumulatively has the most number of cases is our population that is between the ages of 18 and 39. And not only do they have the most cases in that age group, the rate of disease is highest in that age group as well. And that's important to note because early on in the outbreak, our highest rate of cases was in those persons 80 years and older. Another point I'll make on this particular screen right here, you see down on the left, we have data split out by race and ethnicity. For many, many months, we've been talking about the story of the increased rise in COVID-19 disease in the Hispanic or Latinx community. Well, I can now say that the white and Caucasian population has nearly surpassed the Latinx Hispanic population, and that is a concern of ours as well. So the cumulative numbers in the white population are surpassing any other racial and ethnic group, although when we look at the rates among the Hispanic Latinx population are more than 2 times greater than any other subpopulation and more than 2 times greater than the African American and Asian subpopulations. We've looked at hospitalizations and we've talked about hospitalizations a lot over the last couple of weeks. We have seen, and I did report last week, that cumulative hospitalizations in the 18 to 39-year-old population has also surpassed the 80 plus age group. And that's certainly something that we need to continue to note. Hospitalization can be indicative of the severity of the illness, and seeing those rates climb is potentially problematic. When we look at the rates, we continue to see rates of hospitalization being higher in the oldest age group, but the sheer number of individuals getting hospitalized is a concern. And as we look at deaths, we will reflect as well here that in recent weeks, the African American population has been surpassed by the white population in terms of total deaths, and that continues to climb countywide. The rates overall for both groups are pretty similar, and certainly we want to continue to monitor that. While the death rate might be the highest in the oldest age group, we are seeing an increasing number of deaths in other age groups. We have an expert on testing coming to talk on this briefing after me, but I will continue to note that our testing numbers have decreased, and that is an unfortunate trend that we've seen really over the last 2 months. Our 14-day trend for percent positivity in Milwaukee County is relatively flat, and I'm sure Allison will have more to add to that story as well. I'm going to end today by talking about our incidence maps. This first map is an incidence of new cases throughout the pandemic, and we can see where the areas that are red are spots that are more indicative of high rates of COVID disease. And then when we look more recently at just what's happening over the last week, we see a very strong correlation of cases in the city of Milwaukee on the east side, Whitefish Bay, Shorewood, the south side of Milwaukee, into West Milwaukee, and we even see some spots of concern in the southern suburbs. So it's something we want to continue to watch very carefully, as this data is some of the most recent in terms of case activity throughout the county. I just want to end today by talking about a couple factors that are really concerning in the data. The COVID-19 data in Milwaukee appears to indicate that we might be on the upswing in terms of cases within the county, with much of that current increase centered within the city of Milwaukee. With the larger growth in cases most recently amongst those that are 18 to 39 years old, we could presume that this is largely due to the start of the academic year and more cases being identified in Milwaukee area colleges and universities. But we do know that data occurs amongst other population groups, and the 18 to 39-year-old age window is a very big window. We need to give more careful consideration and attention to this data in coming weeks. But unfortunately, we also note that the pattern of increased cases is not something that is occurring in Milwaukee County alone. Today, the state is reporting its highest number of positive cases in any one day. The state is reporting 2,034 cases, positive COVID cases in the state, which signifies a continued surge of COVID-19 elsewhere in the state, and at rates that are probably a lot larger than some of what we've seen in Milwaukee County over the last few weeks. The data continues to support that testing has dramatically decreased, and we know that tests are readily available. So we encourage all of you who needs a test to seek out a test, and we'll talk next about some tools and where you can find that testing for you. Thanks very much for your time. I will now turn the briefing over to Allison True from the 16th Street Community Centers and the co-chair of the Milwaukee Community Testing Initiative. Thank you.
Wonderful. Thank you so much, Darren. And thank you so much for having me today. I'm really excited to talk about this initiative and this new platform, and obviously directly following all the statistics. I think it's clear to see the necessity and that testing is a huge piece of this fight against COVID. So making sure that we're addressing why people aren't getting tested, how we can encourage them to get tested, and better connecting them with resources that exist, and the information that is available is a key piece to how we work together moving forward. So thank you for that. I'm really excited to launch this today, the Test Up MKE website, or we like to call it a platform. As I think Dr. Weston and Mayor Barrett mentioned, it is a new space online for everything that you need to know about COVID-19 testing. And I think the key piece to this is that we're really focusing on making it a trusted space, that the goal is to help everybody in the community, no matter where you're from, your language, your situation, understand and navigate the COVID testing situation. Although we've been in this environment now for some months, I think it's important to recognize that it's still somewhat of new territory, and we're still trying to figure it out as residents, as community members, and just get all the pieces together that we need to be able to make the right decisions and feel empowered to make the right decisions. So we hope to, through this website, to provide not just information that you need, but a dynamic space that has consistently updated information, that's accurate, that answers questions, and that it's in real time so people can really trust it. It's difficult right now, as Dr. Weston alluded to, that it's really kind of a time of uncertainty and information is changing. And we want to make sure that this space is changing with the environment, and that when people come here and look for testing information, whether it be a testing site, or I have this question about contact tracing, or do I really need a test, that they can trust that this is a place that will give them accurate, up-to-date information. And I think that's something that's definitely needed right now, that go-to trusted space. And kind of in that spirit, in addition to it being a difficult time of uncertainty, we really see that it's a time of unity, and we wanted to reflect that in this platform. And it's reflected definitely through the multiple languages and the visuals that you'll see, and the messaging that we're using to connect with all people. As cliche as it sounds, and however many times we hear this, we are in this together, and we want that feeling of inclusion and unity to really be at the forefront of this platform, and that every person that comes there feels like it's a space for them, that they can get what they need. I know it was alluded to before, but I think it's important to note that Test Up MKE was brought together by, as we heard before, a group of community leaders through the COVID testing initiative. And we're all representatives from community organizations across the healthcare field, health department, community health centers, hospital systems. But most importantly, I think it's unique because it's a group of people that are not only in that space and in the communication space, but they're working on the ground and kind of are in the mess of it, really connected to people's reality around testing and what they're experiencing. And that's really important. in addition to that, to making sure that it's a space that people connect with. And in addition to us as representatives kind of leading and supporting this charge, I have to say the site is 100% informed and framed by people like you and me, community members that are living through this pandemic, trying to figure it out with questions, concerns. And when you visit, you really will feel that community voice because it's made for us by us. You'll notice, for example, that we've used language and messages that are really easy for all of us to understand. It's been organized in a way that is easy to digest. I think I can speak for everyone when I say we're all experiencing a little bit of an information overload. And it's really hard to know what to listen to, what to trust, how do I decipher information coming from all of these different sources. I can guarantee that at Test Up MKE, you do not have to have a PhD to know what's happening, to know what to trust or understand what to do. And that's really important. We've gone back and forth numerous times with experts, community organizations, residents, and have a constant flow of information, feedback coming in from people on the ground to make sure that, yes, the information is helpful, it's accurate, it's up to date, but also that it's accessible for everybody in a real way. We've also, as the mayor mentioned, got to connect with a lot of other groups and initiatives that are happening right now, and that's really key because we're able to, yes, extend our reach through each other's work, but we're also able to lift up each other's work and support each other in kind of this goal of increasing testing, increasing health around the COVID situation. So I'm really excited. I think if it's okay, I'm just going to kind of do a quick demonstration and dive into the site. Let's see here if I can get my screen to share. Okay. So there's a few things that I will just kind of point out so everyone can get a little bit of a lay of the land. The first thing, as I mentioned before, the multiple languages. So the site is available in 5 languages: English, Spanish, Burmese, Hmong, and Arabic. And they're all natively translated, so it should feel extremely relatable no matter what your language of preference. We also have an accessibility tool, which is wonderful. So individuals with disabilities are able to choose and navigate the site in a way that works best for them. We also have what I think is a really, really excellent source of information, people, is an assessment. So you'll be able to find it here, and they get tested and they get answers. It's sprinkled all over the site. And what it is a tool for individuals to kind of run through and figure out, get a little bit of guidance on whether or not they need a test. This, of course, is not meant to replace medical guidance or medical care, but it's just a tool for people to get a better understanding of what's happening, what they may need to do, and be able to kind of walk through something, normalize the situation, and figure out maybe what their next step could be without the pressure of having to give any personal information, show up anywhere. We know there's a lot, for a lot of people, making that step to share your information, to go here, to go there is big. So we want to make sure we're able to give people a way to walk through that information themselves and take it in, moving them hopefully one step closer to getting a test if they need a test. And it's got, I'm not going to go through it today, I'll let you walk through it, but it's got a number of photos and is very easy to navigate. And it actually pops up on the right side of your screen here too. I just disabled to make it easier for the presentation today. And of course, some of the main resources that you would expect to find on the site. We have all the testing locations organized by map and by location, a number of frequently asked questions that were informed by a lot of the work with people on the ground during surveys, talking to the community, resources, information about our partners and ways you can get involved as an individual or a community. And then, of course, a number of things that helps us connect on a human level with each other, sharing stories about why I did it, what I did it, how easy it was, what happens. A lot of times we know that the best way to get somebody to make a choice and change a behavior is by connecting person to person with somebody you trust. And so that's a big piece of this site as well. So I think with that, I will not scroll through the whole thing with you guys, but I'm really happy to be able to share it with you today. And I think as we heard before, testing is just such an important piece, and we hope that this platform can be the space that meets people where they are, understands needs, barriers, whatever they may be, and then is able to connect, all of us to the testing resources that we need, no matter kind of the space in our life that we are. So I think that's all for me. I encourage you all to check out the site, share it, and help us spread the word about this new resource for Milwaukee.
Thank you, Allison. We do have a few questions showing up in chat. So the first few questions are for our health experts. How long have testing numbers been down, and are we seeing any improvement in that in the past week, or is it still a major issue? The second question is related to smaller colleges with rapid test results. Providing COVID-19 test results within 20 minutes starting in mid-October, would rapid test results help better control the spread within a college setting? And should there be more frequency with testing students in Milwaukee's university, such as daily versus weekly or every other week?
Sure, I can start with that, Sydney. Testing numbers have been down really since July. The peak that we saw in terms of testing numbers in Milwaukee County was the second week of July, and we've had a steady decline in overall completion of testing since then. The capacity to do the testing has remained the same, but the actual completion of testing has decreased. The second question was about rapid testing. I know many of these rapid tests, antigen tests, have been deployed in various settings across the country, and many are coming into Wisconsin for universities, colleges, as well as nursing homes and CBRFs and other skilled nursing facilities. The jury's a little bit still out on those, because those tests, as designed, they need a follow-up nasal swab and a PCR test for confirmation. So while they can help provide rapid answers, they are not the end-all be-all, and many of these tests we're working through the bugs as they're getting deployed as we speak here in Wisconsin.
The other question that came from Sharon Bajenda at CBS 58, more of a seasonal question. Are pumpkin patches considered a safe activity this season?
In public health, we like to say that any activity that creates a gathering is not exactly a safe activity. So some of the things that I would be asking myself if somebody was asking me about a pumpkin patch is, who are you going with? What time of day are you going? How many people are going to be there? What are the rules and considerations put in place by the pumpkin patch to limit close activity, to limit large crowds? I think in the world of COVID that we live in, we need to ask these questions each and every day, not only of pumpkin patches, but neighborhood gatherings that might start off small and relatively innocuous that could certainly blow up to become bigger gatherings. So I think we just have to start asking ourselves those questions. And most importantly, if you are going to go out, make sure you're watching your distance, you're wearing a mask, and you're washing your hands or using hand sanitizer frequently.
Yeah, I would just say I think that's exactly right. To be cautious with every activity you do. I think especially going into the fall, there's gonna be lots of different activities. Pumpkin patches may be one of the safer ones. It's outdoors. You can distance yourself from others, presumably. You can bring some hand sanitizer along for the end, and hopefully a pretty safe activity. But I completely agree with what Darren's saying, that you really have to be cognizant of what you're getting into before you leave the house. That's been the case since the beginning of the pandemic.
Thank you. Our next question is from Sari Lesk at the Milwaukee Business Journal. A press release today says the county projects a $300 million impact from the pandemic and $100 million in lost revenue. County Executive Crowley, could you please explain how those figures are calculated, and also how much money is the county putting toward the Small Business Initiative Grant Program? And is it all from CARES Act funds?
Yes, good question. So the $100 million in lost revenue is included in that $300 million. And the $300 million figure comes from reopening costs, lost revenue, expanding the services that many people are needing right now because we see an increase in demands, but also as we continue to see the increase in racial disparities as it relates to the COVID-19 pandemic. But as we talk about the grants that we're going to be available for small businesses, it will be about $7 million going towards these small businesses, and these are all coming from CARES Act funds.
Thank you. Our next question is from Patrick Palantonio at WISN. Question for Mayor Barrett and potentially Dr. Weston. There's a lot of emphasis on positive cases in the education system, kindergarten through college. What is the COVID rate for city workers who are not teachers, specifically workers such as police, fire, and DPW employees? These were workers who may be going in and out of buildings, offices, vehicles, and interacting with the public.
Yeah, it's an important question. I don't have those numbers in front of me right now. It's certainly something we can get back to you on. But the take-home point there, especially, is the beginning of your question. We are seeing concerning trends. I think the most specific trends we're seeing are through universities right now. So when we look at UWM, the census tracts around there, just looking now, in the last 7 days, one census tract has 36 cases, whereas it had 11 cases the week before that. So we're seeing concerning increases in those census tracts. But certainly we'll get back to you about the city workers and what sort of trends we're seeing there.
We'll follow up on that as well. Thanks, Doctor.
Thanks. Our next question is from Brett Lemoyne at Fox 6. What happens to Milwaukee's mask mandate if the state mandate is not renewed? That question would be for the mayor and Darren Roush.
Well, our mandate is not based in any fashion whatsoever on the state mandate. It was done independently under our home rule. It was passed by our city council. I signed it into effect. So whether the state law is in effect or not, our law remains the same.
And I'll point out that in many of the suburban communities, there are mask mandates or mask resolutions or mask ordinances. They have different names in different communities. Wauwatosa is one that has a mask ordinance. I believe Shorewood, Whitefish Bay, and a couple of the North Shore communities have them as well. So those would be in effect even after the statewide mask mandate would go away. And in conversation with many schools and businesses and other entities throughout my community, I know many of them are looking at creating policy level decisions for their schools, for their institutions that may create a mini mask mandate, if you will, within their buildings.
Our next question is from Mary Spicuzza at the Milwaukee Journal-Sentinel. Some schools and health departments across the state are publicly reporting COVID cases in schools, some are not. Consequently, the public's access to information depends on their zip code. We're asking all health departments in Milwaukee County to publish the number of cases by school. Will you do this?
That would be something that I would have to take back to my colleagues, but I will point out that a lot of jurisdictions, a lot of schools are already putting out very transparent numbers on dashboards as we speak. So with the combination of schools that are starting virtually, some are in person, certainly the transmission is very low or non-existent in schools that are starting virtually. But that would be a policy discussion that we would continue to have amongst the health departments in Milwaukee County. I know many schools have taken that on and have created dashboards that indicate their cases, and in some cases, even the number of people who are currently under quarantine as well.
And I will say this to Mary. Mary, I don't know if you're talking about suburban schools or city schools or public schools or private schools or choice schools. If we can follow up on that and have you talk to someone in our office, we'll work with you in the health department if we're the issue. I don't know that we are, but we're happy to work with you if we are.
The next question is for Director Roush or Dr. Weston, again from Patrick at WISN. Is there a connection between the Labor Day holiday and the upswing in cases in the 18 to 39 age group?
It's certainly possible. The incubation period of COVID-19 is about 14 days, so we certainly would start to anticipate that if any cases are related to Labor Day activities and large gatherings that occurred around the Labor Day weekend or the last weekend of the traditional summer before school started, we would start to be seeing those cases this week. I don't want to sound alarmist when I said we are on a little bit of an upswing. Next week's data will tell if we truly are swinging up or if this was what we've called in the past a blip in the data. It's just a little bit too soon to know, but it's something we're going to continue to carefully monitor.
Yeah, and I would just expand on that, that one of the things we've seen throughout this, whether it's elections, protests, anything like that, it's always difficult to pin a certain event to a rise in cases. And I think Labor Day will be similar. There's a lot of confounding factors. Kids are going back to grade school, high school, kids are going back to college. So there's a lot of confounding factors, but one way or another, we are seeing that leveling off in the downtrend in case numbers that we've been seeing. So that'll be a number to watch closely.
We have a follow-up question from Sharon at CBS 58. Should there be more frequency with testing students at Milwaukee's universities, perhaps daily versus weekly or every other week?
I'll take a first stab at it. I think each school is doing their own kind of practice moving forward and working with their health departments on what's most appropriate for them. There was a question about the rapid tests. Those are being deployed in various areas throughout Milwaukee County as well. I think what Beloit is using is the Abbott rapid test, which is still one of the more traditional PCR tests. But regardless, there's a few different types of testing modalities. Each university, I think, has to work with their health department, also work with their population of students, depending whether it's students that live on campus in dorms, live off campus with their families. It's going to be a different dynamic for each university. But testing is going to be key, just as it is in the community, and detecting cases and isolating and quarantining people as needed.
We have just a couple more questions in the chat. For anyone in the group, what are your thoughts on the Catholic Church encouraging its members to return to Mass?
One of the things that I've said since the beginning of this is, unfortunately, there are no exemptions to COVID that come for religious purposes or political purposes or educational purposes or sporting purposes or even family purposes. And so I want everyone to do what's right for their health. I think that that's very, very important. And so obviously individuals are going to make that decision. But I don't think anybody should assume that because someone has said do this, it means that it's necessarily safe. I think, as we've said all along, it's important to follow the health experts on this. And I hope we continue to do that, again, for religious, for educational, for business, for all reasons.
I would have to echo the I mean, there aren't any exemptions when it comes down to this. And people have to make sure that they're protecting themselves. And that's, again, remembering the 3 W's, watching your distance, washing your hands, and wearing a mask. And so, we know that people are going to go to church. And if they are, we want them to continue to practice physical distancing. But at the end of the day, we need to lean on one another to make sure that we can put this pandemic behind us. And that means staying safe and not going to too many places where large crowds can gather.
And it looks like this is our final question. It's again from Mary Spicuzza at the Journal Sentinel. Would anyone like to comment more on the record number of new cases in Wisconsin, more than 2,000 new cases today?
I can tell you I'm very concerned at the level. When I saw the report that had Wisconsin now among the 5 highest states in new cases, it was very disconcerting to see that. That's not a place where I want us to be. And I think it's pretty clear that it's the college campuses that are driving this more than anything. And I think that there really has to be a redoubling of efforts to make sure that college students are taking this seriously, because it clearly is having an impact right now. That's my opinion.
And it is concerning. I mean, the fact that we have 2,000 to date, we've hit a record. And we know that we see a rise in cases between, again, the age population of 18 and 39. I mean, we are not invincible as young people. We need, again, to lean on one another to get this pandemic behind us. And so, we have to do our due diligence. Folks need to make sure they're getting tested. But again, we have to make sure that we're following the 3 W's so we can all be safe as we move forward.
I would agree. I think, going into the fall, going into the school season, we knew there would be ups and downs with our COVID numbers, both locally and as a state. But it feels like this is starting to become a turning point. We've been doing really well up to this point. But we know, again, the school year, the fall, are unknowns, how that's going to affect COVID. So this is a time to be especially careful so we can take that turning point and continue to flatten those numbers rather than start to see them increase in a really worrisome way.
All right, that wraps up our questions. Thanks again for your time, and we'll see you again next week on Tuesday.
Thank you very much.
Thanks, everyone.
Thank
Thank
you.